We've got an update on a device we've seen previously on Smart Medicine. Baptist Women's Hospital recently received the Da-Vinci Robotic surgery device, and about 30 doctors have been trained in its use. As Lurene Cachola explains, it's being used to offer even more treatments for patients than before.
A recent operation for preschool teacher Stacy Rogers was much easier than either conventional surgery or traditional laparoscopy. Her hysterectomy was performed with the help of a robot, a simple procedure with a quick recovery and little pain.
It was fine. I had my surgery on a Wednesday. By Monday I was driving. Didn't have to stay in the hospital, was not on pain meds long. Like I said, I was able to drive. 2-week post-op, I came and no real problems. A little tender in your belly, but that was it, and really that had kind of gone.
Her surgery was performed with the Da-Vinci, a robotic system that allows doctors to manipulate robotic arms to make 5 very small incisions. 4 allow cutting and sewing, and a 5th has a camera, so the surgeon can see what's going on. The system is less invasive, particularly for gynecological procedures.
The main benefits to the patient is much faster recovery. They really are back on their feet, out of the hospital and back to work a lot faster. The traditional hysterectomy recovery could be 6 to 8 weeks, and a little over half my patients actually go home the same day.
Baptist Women's Hospital recently received the latest generation of the Da-Vinci system. The new device features an improved camera and more responsive controls. Doctors use hand and foot controls inside a console to manipulate the device, which is poised above the patient. The cameras can give surgeons a nearly 3D look at what they're working on.
Well, it's actually a lot easier. They've called the company intuitive because that's exactly how it is when we use it. When we actually move our hands, that is how the instruments move inside of the body. The traditional laparoscopy, if I want my instrument to go to the left on the outside, I'm actually moving my hand to the right. And so it's counterintuitive, versus now the instruments move exactly what our hands are doing at the console.
An additional benefit to surgery with the Da-Vinci is a lower risk of post-surgery infection.
Hey, how are you today?
Rogers got back to everyday life quickly enough and pain-free enough for her to recommend the Da-Vinci procedure to others.
And not only would I tell them that, I already have. I've had some friends that said, yeah, I've been looking at the possibility of having to have a hysterectomy. And I'm like, absolutely. You know, had mine at Baptist Women's, Dr. Bishop did it, this is what they did, and I was in and out, you know, very quickly.
For Smart Medicine, I'm Lurene Cachola.